Two articles published in the Lancet Child and Adolescent Health reveal a devastating global gap in care for children. Every year, over 10 million children experience serious health-related suffering and need palliative care. 96% of these children live in low and middle-income countries.
Behind the groundbreaking articles published in The Lancet is a passionate and dedicated team who refused to accept the status quo.
For children with cancer, other life-limiting illnesses, and those needing palliative care, opioids are not optional. They are essential medicines.
Ensuring appropriate access is a shared responsibility and requires sustained efforts across health systems to better meet children's needs.
There is great disparity in equity around the world. In wealthier nations, controlled medicines are usually accessible, but in low and middle income countries, the gap is wide, leaving children without essential treatments.
It is a reflection of regulatory imbalance, limited child-friendly formulations, and policy gaps that keep the children off the access agenda.
It is a powerful reminder of why policy and sustained advocacy matters, especially in times when attention is stretched and inequities risk being overlooked.
We also know that general policies are not enough. If children are not explicitly placed at the center, they will continue to be left behind. What we need now is child-centered reform.
Controlled medicines must be available for pediatric medical need. The real test now is implementation.
New studies reveal the barriers to providing life-saving medications and medications to improving quality of life of children with serious illnesses, and these are structural, regulatory, and economic barriers.
Some stem from weak health systems, fragile supply chains, and uncertain demand. Others are specific to children, especially the lack of age-appropriate formulations. And some result from safety and control measures that are not always adapted to the contexts in which children live.
In 2024, a critical resolution was passed, but the fight for equitable access to controlled medicines is far from over.
Improving children's access to controlled medicine demands more than policy commitment.
Pediatricians, scientists, and global healthcare leaders united to bring global attention to the crisis facing children in need of controlled medicines.
The World Health Organization guidelines on balanced national controlled medicines policies to ensure medical access and safety, which were published last year, state that controlled medicines are essential for treating many conditions and should be accessible, affordable, and available to all patients, including children in need.
This is not just a health policy issue. It is an issue of health equity, human rights, and basic human compassion. These papers in The Lancet can help guide decision makers to take decisive action, so children's suffering can be replaced with relief, dignity, and hope. Imagine a world where no child has to suffer unnecessary pain.
Today marks a meaningful step forward for children everywhere, but the work isn't done. We will continue until every child, wherever they live in the world, has access to the medicines that they need.
It's time to fight for children's right to relief and dignity. The world needs action now.
And together we can ensure every child gets the care they deserve.